Next, we move on to specification number 16, which asks us to describe the effects of tobacco smoke and its major toxic components, nicotine, tar, and carbon monoxide. In this section, we will examine how these substances affect the body, their link to diseases such as bronchitis, emphysema, lung cancer, and heart disease, as well as the effects of smoking during pregnancy, including reduced birth weight in babies. Smoking is a major cause of chronic obstructive pulmonary disease or COPD, coronary heart disease, and several types of cancer, particularly lung cancer. Tobacco smoke contains many harmful chemicals, but three of the most damaging are nicotine, tar, and carbon monoxide. Tar is a carcinogenic substance that increases the risk of developing cancer. Nicotine is an addictive drug that also narrows blood vessels, raising blood pressure and heart rate. Carbon monoxide is a toxic gas that binds to hemoglobin, reducing the blood's ability to carry oxygen. Together, these substances contribute to severe long-term health problems affecting the lungs, heart, and even unborn babies, highlighting the dangers of tobacco use. A normal lung has clean, open airways and elastic alveoli, allowing efficient gas exchange and easy breathing. In contrast, a smoker's lung shows tar deposits, inflammation, damaged airways, and destroyed alveoli. As shown in the diagram, healthy lungs appear light pink and clean, while smokers' lungs are discolored, often gray or black due to tar accumulation. In healthy lungs, the airways are open and alveoli remain elastic. In smokers' lungs, inflammation and tissue damage reduce elasticity, making breathing more difficult and lowering the efficiency of gas exchange. Tobacco contains several harmful components that have serious effects on the body. The most important of these are nicotine, tar, and carbon monoxide. Together, these harmful components are responsible for many health problems linked to smoking, including lung disease, heart disease, cancer, and complications during pregnancy. Nicotine is a highly addictive substance, which makes it very difficult for smokers to quit. It also narrows blood vessels, raising blood pressure and putting extra strain on the heart. This narrowing makes it easier for fatty deposits, including cholesterol, to build up in the walls of blood vessels. If this occurs in the coronary arteries, it can lead to coronary heart disease, reducing the oxygen supply to the heart muscle. When the heart muscle receives insufficient oxygen, heart cells switch to anaerobic respiration, producing lactic acid. Reduced blood flow prevents the removal of lactic acid, lowering pH and denaturing enzymes, which damages heart muscle cells. If enough cells are affected, a heart attack may occur. Nicotine also impacts the developing fetus by narrowing the blood vessels in the umbilical cord, reducing the delivery of oxygen and nutrients. Babies born to mothers who smoke often have low birth weight. Smoking during pregnancy can also cause complications such as placental detachment, bleeding, premature birth, miscarriage, or stillbirth. Next, tar is a sticky, black substance and one of the most harmful components of cigarette smoke. It is a major contributor to cancer and chronic obstructive pulmonary disease or COPD. Tar is carcinogenic, meaning it strongly increases the risk of lung cancer as well as cancers of the mouth, throat, and esophagus. It also stimulates goblet cells and mucus glands to grow larger, leading to excess mucus production. At the same time, tar damages and destroys cilia, preventing mucus from being cleared from the airways. The trapped mucus collects dirt, bacteria, and viruses, prompting the body to respond with persistent coughing, known as a smoker's cough. This repeated coughing can injure the delicate epithelial lining of the airways. Over time, the damaged tissue forms scar tissue, narrowing the airways. Long-term irritation and infection lead to scarring and narrowing of the bronchioles, causing chronic bronchitis. Continued inflammation and damage to the alveoli result in emphysema. Together, these conditions make up chronic obstructive pulmonary disease, or COPD. Carbon monoxide is a toxic gas that binds to hemoglobin in red blood cells much more strongly than oxygen. This reduces the blood's ability to transport oxygen around the body, leading to several harmful effects. The respiratory system must work harder, increasing the rate and depth of breathing to take in enough oxygen. The circulatory system also experiences extra strain, as the heart must pump faster to deliver the limited oxygen available. Over time, this puts individuals at higher risk of coronary heart disease, heart attacks, and strokes. People may also experience shortness of breath and reduced stamina. During pregnancy, carbon monoxide reduces the oxygen supply to the fetus, which can result in low birth weight, slower development, and an increased risk of miscarriage or stillbirth.